Good morning, everyone. I always dreamt to be on a live stage, but as a famous singer, not to talk about green clinics. So my name is Mohammed Abunar, and I'm the Senior Country Director for Pathfinder International. I'm based in Egypt and responsible about Egypt, the Middle East, and North Africa. It's my great pleasure and honor to be here, and I really would like to thank ICFP for this extremely important initiative of Live Stage. I am a civil engineer. I have a master's degree in projects planning and scheduling and cost control. I also have another master's in business excellence models and total quality management. And my doctorate degree is in the effect of transformational leadership on integrated system strengthening. So what am I doing with green clinics and family planning? Okay, climate change. Living in Egypt, I just came from COP27. And believe me, all the countries now are realizing the importance of addressing climate change. We all know that climate change is now a very hot topic and is really affecting the health of people and the communities, directly and indirectly. Directly, when we see the extreme heat, when we see the floods, when we see the droughts, and indirectly, how those communities, especially the poor communities, are affected with migration, displacements, and so forth, and how they're interacting with their surroundings in cases of shocks. So, before I really dive into my presentation, we prepared like a poll with 2 questions. I'd like our colleagues and audience online to try to answer those very difficult questions. And I'll try to interact with the audience here to try to get a flavor of the answers. So the first question is, climate change has worsened drought conditions everywhere, hurting people's livelihoods. So the question is, who produces up to 80% of the food in most low and middle income countries and is responsible for half of the world's food production? So is it women or women or women? Can anyone in the audience help me with the answer? I think it's women, yes. The second question is, women and girls are at highest risk in a changing climate. Why is that? So, is it because they face limited educational opportunities and options for climate-resilient jobs? Or is it because they face early marriage and pregnancy, inhibiting their ability to escape poverty? Or is it because they are more likely to work in food production, which is easily threatened by the climate crisis? And I believe we all know that the answer is all of the above and even with more. I live in Egypt. We work as Pathfinder as a community-based organization. We consider ourselves as a grassroots organization, a global health organization that is implementing community-driven and locally led projects. So we work in the Middle East, in Asia and Africa, in the very hard-to-reach communities. So imagine seeing a woman or a pregnant woman not being able to deliver in a hospital because of climate change effects and floods. Imagine young people not being able to reach their clinics for contraception or health services. Imagine the poor ladies who are really working in agriculture, and due to climate change, the crops are damaged and they do not have a source of income for their families. These are realities that we're living. And we all know that the most affected population with climate change is elderly people, women, and girls. So what are those green clinics? In Upper Egypt, in Suhag Governorate, it's a very hard to reach area where the poverty levels are so high and health and quality of health is not good. So we work through a total market approach, working with the government. We work with the NGO sector and the private sector to improve the quality of care, mobilizing communities, and trying to build and support the health systems. So in our selected clinics, we work on improving the quality of care through providing all types of capacity building and training for the service providers, and not just medical or didactic or clinical, but again, managerial. But what else? We're helping those clinics to become greener, which means the service providers are provided with the training and orientation and awareness on the impact of climate change on the health of people and how to deal with shocks and how to respond in cases of shocks. Those clinics will be operating utilizing environmentally friendly measures, having solar panels, having sensors for water utilization, have environmentally friendly waste disposal methods. So at the end, we're trying to make those clinics cleaner, greener. But again, we believe that we cannot just work from a service provision perspective, but it's also so important to work as well on the community level. So it's a supply and demand. We believe that there is always this zone of interaction between the service provision and the community. Accordingly, we want to make those communities also greener by orienting them on the hazards and impact of climate change, by putting women in the leadership position because they are really the most affected, water utilization, clean cooking, all of the aspects that are related to environmentally friendly aspects. I think it's so important when a woman who is relying on agriculture to be given a plan B in case something happens to the crops. So we teach those women through a micro-enterprise activities and help them also produce environmentally friendly products. And we also work with the health systems to ensure that they understand the concepts and the hazards of climate change. People get to know not to build in the way of the floods, torrents. They build their houses. So in cases of shocks, they are all underwater. Great. So now we have seen the importance of really acting together. The future is integration. We cannot afford just to work on family planning and reproductive health alone. We cannot work on education alone or adolescence and youth alone. I think gender equality, family planning, reproductive health, climate change, all these programs should be integrated. Let me just ask from my position here, all the donors and the implementers, please include an integrated approach that takes into consideration climate change and the impact of climate change. Many people are going to tell us, is it possible to remedy what has been done through the whole past years? Is it possible? But let me answer them with a very simple quote by Adidas that says, impossible is just a big word thrown around by small people who find it easier to live in the world they've been given than to explore the power they have to change it. Impossible is not a fact, it's an opinion. Impossible is not a declaration, it's a dare. Impossible is potential. Impossible is temporary. Impossible is nothing. If we do not act now and really consider the impact and the hazards of climate change very seriously, our children and grandchildren will pay a huge price. Thank you very much.